Christopher Labos, who's a cardiologist and epidemiologist, speaking to us from Winnipeg in Canada. Doctor, it's good to have you on the program. This really feels like quite a milestone for a disease that can be so deadly and is so deadly to hundreds of thousands every year. And it makes one wonder, why has it taken so long for a vaccine like this to actually be rolled out?
Well, I mean, it's not as if people weren't trying. The difficulty was in actually creating a vaccine that was safe and effective. And I think after COVID, we have this sort of slanted view of how science works, where if you want a vaccine, you just sit down and you make one, and it's done within a year. We've had some very notable successes in vaccine research in the past couple of years. The RSV vaccine being one, the malaria vaccine being another, but people have tried. It really hasn't been successful. So this is the first time when you have a vaccine that looks as if it has, admittedly modest, but it really has the potential to really at least make a dent in malaria cases and help in conjunction with all the other things that are being done for malaria control, like the mosquito nets, like the malaria prophylaxis, like clearing out mosquito breeding grounds. So it is now one extra tool in conjunction with everything else that exists.
So when you talk about making a dent, what could that dent actually look like going forward?
Well, the quoted vaccine efficacy, as you mentioned in introduction, is between 30 and 40%. So, I mean, obviously you would want vaccines to be 100% effective. They rarely are, but it will help reduce the number of cases. In and of itself, the vaccine is not going to eliminate malaria, but if you can couple that with all the other stuff, reducing the size of the mosquito populations, getting rid of their breeding grounds, getting rid of stagnant water where mosquitoes tend to breed, and also making sure that people have access to mosquito nets to prevent the transmission of malaria, in conjunction with using the medications that can be used to prevent malaria infections. All of that stuff together is going to help. It really goes back to, again, another term that became popular during COVID, the Swiss cheese model, which is in and of itself, no single intervention is going to be enough, but taken together, they can have a substantive decrease in the number of malaria cases. And that is fundamentally the goal, is to have less malaria and less people getting sick from it, and putting less of a burden on countries where malaria and malaria deaths are quite substantial.
And many of those countries are in southern Africa. How long do you think before we could see it rolled out to other African countries, especially to those in the south where there are so many cases every year?
Well, that is the important question. One hopes that if you can demonstrate the ease of a rollout in one country, then it becomes much easier to roll it out in others. It is going to depend on funding, and there's a lot of issues to this. It's sometimes very hard to get the global north to fund initiatives that predominantly affect countries in the global south. My hope is that the growing realization of the importance of something like this is going to motivate people and countries and NGOs and the various actors to realize that we have to put money into this type of initiative, because even if you're like me and you live in a country where malaria is not very frequently seen, we have to realize that globally it's a major problem, and that we have to put resources into fighting diseases worldwide, not just the diseases that affect us in our little corner of the planet.
Absolutely, and hopefully this is the first step towards seeing an eradication of malaria, especially in Africa. Dr. Christopher Labos in Winnipeg, thank you.